My name is Dr. Monica Cisneros. I'm a doctor of chiropractic, and I'm also a functional medicine specialist. And I want to introduce to you the type of lab work that I do in my practice. Obviously, there has to be medical necessity. Right now, the priority of my testing will be COVID-19 testing, the antibody testing, because we need to stop this health crisis. But also, the practice that I have addresses the underlying causes of making you prone to get infected and not be able to fight it. So I want to give you an overview of what I offer and the information we gather by looking at different labs, using different labs, using different lenses to look into the human body. So we're just using all this information to come up with the roadmap of your health and how you can be healthy. Let's start by our general chemistry labs that we run. We're basically just doing glucose, kidney function, liver function, B12 and folate in the blood, glycohemoglobin, which is an indicator of diabetes, cholesterol panel, triglycerides. We are doing our iron studies, our CBC, which tells us if there's an active infection, if lymphocytes are abnormal, monocytes, neutrophils. Then we have a liver antibody testing that we run, thyroid function, urinalysis, urine culture, vitamin D, set rate, and all these labs gives us an insight of your overall health. And that is very, very important because studies have shown that in abnormal iron studies, low vitamin D, elevated homocysteine, an abnormal liver test are put you into higher risk of getting COVID-19. So obviously our general chemistry, our general health exam, a basic one, is going to give us that data. Going deeper, we use Boston Heart Lab, which is very, very useful because now we're looking at cardiovascular function. And we know that patients that have chronic conditions are going to be at a higher risk of dying from this virus. And this lab, it's very useful because it actually gives us cardiovascular markers. It gives us inflammatory markers, but it also gives us genetic markers. It allows us to see the liver, the heart, homocysteine from a different angle. Okay, so that's what this lab allows us to see. It shows us if there is plaque in the arteries. So obviously before you have an abnormal EKG, an abnormal echocardiogram result of the heart, you start seeing changes in the chemistry of the blood, and that is really important for prevention. Another test that we offer is called comprehensive stool test. There we're looking at gut intestinal dysbiosis. We're looking at gut inflammation, digestion, absorption, intestinal permeability. Why intestinal permeability is so important? Because if the barrier of our gut is broken, organisms, viruses, bacteria can go into the bloodstream. So this part of this stool test is really important to be able to let us understand that barrier, that protection that we have. And our immune system is located in our gut. And that's why this test is very important for us. The other test that I offer, which is to me the one that kind of allows us to measure at a more specific level vitamin status, micronutrient testing. We are hearing all over the news that a lot of the treatments for COVID-19 require zinc supplementation along with antimalarial drugs. Other ones are including medications with vitamin C intravenous. Others are doing iron supplementation. So this is the only lab that you can actually measure the vitamin status in your cell. So think about it, a bank account. You can see how much money you have left in your account. That's what this lab test gives you. The important part about this test is that it gives you an overview of the immune function. This is really, really, really helpful because this dot tells me that optimally you want to be up here to be able to fight up optimal immune system. When this number starts going down, that tells me that your immune capacity to fight infectious illnesses is decreased. And by using this test to interpret the data, we're able to identify which nutrients specifically are low that we need to supplement. So it's not just taking general multivitamin and just saying, okay, I'm taking it. No, here we're getting a specific data. We're not able to do this in the blood. Like vitamin D, we can measure it in the blood, but here we're measuring it in the cell. So this is very critical data here. So in this case of this patient, we're able to see that which vitamins are low. And as you can see, we're seeing these graphs. They're telling us, this is telling us all the B vitamins. So we're seeing here the B1, B2, B3, B6, B12, folate, panthenol, biotin are on the lower end. Okay, so this patient requires a B complex. Sometimes in patients, maybe it's B1, B2, something that is just something that we can give individually. Here we're having our amino acids and metabolites. And why is this important? Because this is what allows us to build DNA to repair. And this is how we want to recover. One of the key aminos here is glutamine. Glutamine has a major role in the binding of the glue on the cells in our gut. So if that glue is not existent or is decreased, organisms, viruses are going to penetrate into the bloodstream. So this information is critical, especially in relation to our topic, COVID-19. Here we have other vitamins that have to do with immunity. Vitamin D in the cell, vitamin A, potassium, magnesium, calcium, zinc, copper, manganese. Zinc is known to be playing a role, and we can be just saying take zinc, but here we know your levels. We can know pre and post lab testing. And lastly, here we have antioxidants. And antioxidants is what allows us to fight cellular damage, okay? So we have the ability to know our glutathione levels, cysteine, and cysteine plays a major role with patients that have been infected, because we know that cysteine plays a role into lung function. So knowing this number, if the patient has low cysteine, we supplement with N-acetylcysteine to try to fortify the respiratory system and try to allow it to regenerate. So we also have a CoQ10, which is one of the most powerful antioxidants, selenium, which plays a major role in immunity, vitamin E, alpha lipoic acid, and vitamin C. Okay, so if you go to your doctor and they are not offering micronutrient testing, well, you're not able to have the data that you need to know exactly where your health status is. So obviously we are doing the COVID-19 antibody testing, but this information that I run routinely as part of my functional medicine practice gives us an overview, an insight, and data is really important, because we're not guessing. We're not just telling you take and you don't know if it's working. We're measuring before and after. So thank you for your attention, and consider having a general comprehensive examination. Thank you.